This video is for full waxing evaluation. So it's brows, lips, underarms, bikini, and full leg. And so we're gonna start this video as if we've just arrived to work. So what we would do is we would initially wash our hands and we would wet them and apply a coin size liquid hand soap, and we would wash our hands down to our wrists. We would wash the back of our hands down to our wrist. We would wash our fingers, and we would wash the backs of our fingers, fingertips and nails. We would wash between our fingers and our thumbs. We would wash our thumbs. We would wash our wrists, and we would do all of that interlocking wash for a minimum of 20 to 30 seconds. And then we would give it a good and proper rinse underneath the sink. And we would make sure everything's thoroughly rinsed. You would grab either disposable paper towels or a clean towel, turn the water off, dry your hands completely. If it's paper towels, you're going to toss it in the trash. If it is a clean towel, you're going to put it in a closed container until it's time to do the laundry. Then you're going to get your 70% ethyl alcohol hand sanitizer, and you're going to sanitize your hands thoroughly. And then you need to prepare your workstation to get ready for your client's arrival, especially because they're getting all of those things waxed. You want to make sure that you have all of the things that you need ready to go so that you are conscientious of not only your client's time, but your appointment times to stay on schedule for your clients. So what we need to do is disinfect the workstation, the bed, and equipment using a disinfectant wipe following manufacturer's instructions. You'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You'll gather clean supplies needed for the facial service, storing in a clean, closed container, and then you're going to dispense products that are needed for the service. So you will prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. You can place disposable table paper on the bed. We're not going to do that because we're doing a full wax evaluation. We're going to make sure that we do the bedding, the sheet, so the fitted sheet, the flat sheet, the blanket, the towel horizontal at the head of the facial bed, because you're protecting the facial bed from the wax, but you want the client to have privacy and comfort when they're having different body parts waxed, so you want them to be warm and comfortable. The last thing you want them to do is lay on table paper, not very comfortable, during this service. And I'm going to show you what I have prepared on my tray, so you'll know what you need to have together. So when we talked about preparing equipment, one thing that you want to do is turn your wax pot on. You need to make sure that it's on at least 30 minutes before the client arrives. So we have, of course, 2x2s and cotton rounds. We have all different sizes of waxing sticks because we're going to be doing all different areas of the body. We have all different sizes of waxing strips. And of course, we've pre-cut a bunch of these because you don't want to be cutting wax strips when your client's here. We have tweezers. Scissors as an emergency in case we need to cut some more wax strips. Hopefully we do not. We have our pre-wax solution. We have powder. We have our remove step where we remove any wax residue. We have a soothing product. This is our wax for our videos. And of course we have disposable gloves because you always are going to be wearing gloves in a waxing situation. You never wax without gloves on. So our tray is ready and our bed is ready. What we need to do now is make sure our client is ready. And this is going to be a little bit more detailed because we are doing the all over the body, different parts of the body. We're going to be discussing lots of contraindications and specifications of why you would or would not wax your client with those contraindications. So we're going to go over that during our client consultation, which we're going to do right now. Oh no, one thing that I need to find that I had for my client is, oops, I just knocked it down. On our bed, one thing that we want to note that we would be putting on our bed is we would be putting different drapes or things that we might normally not put on our facial bed. We need to make sure that we have a drape like you do for a facial, so that this part of the body, they can remove clothing, put their drape on, and they're also going to be removing clothing from the waist down. So you can either have them come in their bikini or bathing suit bottom, or we have disposable underwear here that we use for waxing, so they don't have to get any wax on their own underwear or their bikini bottom. If they happen to wear their bathing suit bottom, you would want to put some tissue then around the lining of their bathing suit so that you don't get any tissue on that. But I think it's just as easy, if they don't mind, to wear those disposable underwear there. That way they're just a throwaway. So your salon would provide that, obviously, depending on their comfort level. So let's talk about our client consultation. And when you go and meet with your client, of course, you're always going to have clean hands. You guys saw me wash hands here to set up. Obviously, I'm going to be washing my hands again before I start the service, but I just want to always make that notation in videos that I would be always approaching my client with clean hands. So let's talk about the client consultation. So you'll greet your client and escort them to the work area. You're going to assess the client's current style and determine the client's preferences. You'll assess the client's needs. You're going to assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. You'll assess client's consultation form for any medications and products used within the last 72 hours. You'll consult on any known allergies. You will consult with the client on any facial surgeries within the last 3 months. And if the client is under a physician's care, you'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. All of this I'm getting ready to go into more detail about. Assess facial injections within the last 3 weeks, Botox or hyaluronic fillers. And then we're going to get into much more detail when we talk about contraindications. So your client for waxing would be filling out a form, but you're going to be talking about a lot of stuff, because some of the things, when you're doing that skin analysis, you might only be able to see her face or his face. You may not be able to see legs or bikini area, or for gentlemen, back, if they're getting back, or chest, any of those things, they might be currently covered up. So keeping that in mind, some of those contraindications, such as certain moles and warts, will become apparent only after working with the client and closely surveying the skin. These contraindications can be noted on the form later, or if you use a software system, you can put them in the software system for your client. But you want to be sure not to wax over these areas to prevent causing irritation or spreading viruses or bacteria to other areas. Some contraindications include the following skin conditions: varicose veins, so those would be for women on the back of the legs or on the legs; unusually pronounced moles or warts; cuts, abrasions, wounds, open sores; active herpes; acne; skin diseases or disorders; sunburn; rashes; cysts, or boils. If any of these conditions are present, do not perform the waxing service. It is important to be aware that herpes in particular is highly contagious, and you should never perform a waxing service on a client who has an active outbreak. In addition, skin diseases that present visible irritation on the surface of the skin should never be waxed. So if anything's here, you're not waxing. The existence of the following health conditions may cause the client to bruise, swell, or experience excessive pain during a waxing service. In addition, conditions such as diabetes impair the healing process. So we want to make sure, if someone has diabetes, that you don't wax them. Poor circulation, chemotherapy or radiation treatments, high blood pressure, low pain threshold, or lupus. And lupus is an autoimmune disease. It's one in which the body's immune system is impaired, so it begins to fight against itself. So they can have severe rashes. There's so many different things that can go into that. So make sure that you do not wax a client that has lupus. And then you also have a lot of medication contraindications, so we're going to talk about those. Number one, when a client is on Accutane, you do not wax them. A lot of these medications make the skin very thin and very fragile. So if someone's on Accutane, they do not get waxed. And if they are on Accutane, they need to be off of Accutane for a minimum of 3 months before they can get waxed. And then clients need to avoid Retin-A and alpha hydroxy acids 48 hours before and after waxing. So oral or topical medications, Accutane, antibiotics, cortisone creams, Retin-A, Renova, alpha hydroxy acids, beta hydroxy acids, or a chemical peel. So none of that, can't be doing any of that topical or on your body or anything, and then have a wax. So make sure you don't do that as a skincare professional. That's your job to be ethical, to do things the right way, to keep your clients safe. All of that is critical. So those are major deal breakers before you can even think about waxing, and you just want to make sure you take the time to do the proper client consult. That being said, we are going to move forward with our service. So because our client does not have any of those contraindications. So we're going to give her privacy so that because she's going to be disrobing from the waist up and the waist down. So she's going to be putting on the drape so that her underarms will be able to be exposed, and then she's going to be putting on those disposable underwear so that we can do her bikini line, and then we're also going to be waxing her legs. So I've given her private time, alone time to change, and then I come and knock on the door when she says it's okay for me to enter. She has put herself in the facial bed, and she's under the sheet and the blanket, and then I'm just going to get her a little bit more comfortable. So I've got a nice little rolled towel here that I'm going to put under her neck for extra support. While we wax the face, I've got a hairnet to keep the hair out of the face, away from the brows. And then I'm also going to take this additional towel and drape her all the way up to the chin. Not only keeps her warm, but it'll keep everything covered up so nothing drops on her, like any of the pre or post waxing solutions or wax or anything like that, which we won't, but we just want to keep her. Basically, I want her comfort level 110%. And then I need to wash my hands before I glove up so that I can get started with my service. So I'm going to go to the sink and I'm going to wet my hands, and I'm going to find that coin size amount of liquid hand soap, wash my hands down to the wrist, wash the back of my hands down to the wrist, wash my fingers, and I want to wash the backs of my fingers. I'm going to wash my fingertips and nails, and I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs, and I'm going to wash my wrists. I'm going to do all of this wash for a minimum of 20 to 30 seconds, and then I'm going to thoroughly rinse everything underneath the water, and I'm going to find either a clean towel or disposable paper towels. When my hands are clean, I'm going to turn the water off with the towel, dry everything completely, throw those paper towels away, or the clean towel will go in a closed container until time for laundry. And then I'm going to get my 70% ethyl alcohol hand sanitizer to sanitize my hands. And once my hands are nice and dry with the hand sanitizer, they're wet, I can put my disposable gloves on. I'm just going to take a real quick sip of water here. And then I'm gonna go in here to my client, to the first service. And what we're doing now is we are looking at her brow. And what we're gonna do is we are gonna analyze the hair growth, so the direction of the hair growth. And so basically what I'm seeing, we already know the shape that she's going for and what she's wants. She does a really good job. She gets waxed on a regular basis. So really we're just going in here and doing our cleanup. The shape is pretty good. We just want to really make sure that we are honoring that shape and just taking away any of that extra hair. And so we're going to go ahead and use our pre-wax solution to remove any oil or makeup that might be on her brows. And that's important because you just want to make sure that you are doing the things that you need to do to not only, the goal here is that we're preparing the skin for the waxing service, but we're also protecting it. So what we're doing right now is preparing, and we're removing any SPF, moisturizer, makeup, anything that might be on this area of the skin that we're getting ready to wax. And we're going to dry it. And then I'm going to do a light dusting of a powder to get that last little bit of oil or moisture that might be on that area. And now we're prepared it, and now we're really, the powder, the nice thing about it is even protects the skin, helps with that protection step. Perfect. And so what we're able to do now is start with wax, but we would never put wax on a client before we test the temperature on ourselves. So that's what I'm going to do right now. So I'm going to test this temperature on me to make sure that it is not uncomfortable. And I'm going to test it on the inside of my arm, and it feels good. I'm just going to remove it, and that's great. So we're going to go on in here and we're going to start with those brows, and I know the temperature feels great, so I'm not worried about that for the client. So I'm going to get some wax on my stick here, and I'm going to scrape the side off, back off, excuse me, on both sides.